15 minutes.
Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I would like to thank again the University of Amoud for organizing this wonderful event. It's really an important event for the whole region. On behalf of FAO, I would like to present the role of FAO in this particular subject. I would give more emphasis in the livestock sector and what we do so far. My name is Abdidek Yusuf. I am an animal health officer, and I started my journey from the wonderful regional institute in Sheikh Igad Sheikh Technical Veterinary School. I was among the first batch that graduated from that wonderful school, and then I went to Makerere University and then Nairobi University to pursue further my studies. As I said, I am a veterinarian by profession, and I'm really excited to deliver this and to participate in this wonderful conference. Okay, so I think this we have already discussed a lot, that the health of the animals, people, and plant and the environment is interconnected. It's an agreement, and everybody is in agreement that since they are interconnected, there is a need to have multidisciplinary approach to take care of all of them. So I would want to spend less time in this slide, and I will skip to talking what FAO does in general. FAO is Food and Agricultural Organization of the United Nations, and when it comes to One Health, FAO promotes One Health in areas of food security, sustainable agriculture, food safety, antimicrobial resistance, nutrition, animal and health and plant health, fisheries and livelihoods. One Health approach was recognized as an opportunity to link, to address the linkage of climate with emerging zoonotic diseases, disasters, food safety, and antimicrobial resistance. And ensuring One Health approach is an essential for the progress to anticipate, prevent, detect, and control diseases that spread between animals and humans. Also, application of One Health approach is actually very important to achieve the United Nations 2020 Agenda for Sustainable Development Goals. So it contributes very much so that we can achieve those goals. To be in particular, FAO's role in One Health is two. Number one, FAO supports the member states to build and implement effective collaborative One Health strategies, which is simultaneously working on both animals and human health, also environment. The second role is FAO collaborates with World Health Organization and World Animal Health Organization, OIE, and also in the form of FAO, OIE, WHO tripartite, in that they create and support One Health programs as well as climate change and One Health. So nowadays we also have the United Nations Environmental Department. So all four agencies are working together to ensure that to collaborate in terms of One Health. there are several priorities that FAO has when it comes to One Health. The first priority is to strengthening monitoring and surveillance and reporting system at regional, national, and local levels to prevent and detect animal and zoonotic diseases. The second priority is to understand the risk factors that are involved in One Health aspects. The third one is to develop the regional capacities. Fourth is to reinforce veterinary and plant health infrastructures. Fifth is increasing the capacities of the food and agricultural sectors to combat and minimize one of the most emerging problems which we have, which is antimicrobial resistance. And last one is to promote food safety and trade at both national and international levels. So at FAO we have the following priorities when it comes to One Health. So that what I was discussing was in generally what FAO was doing globally, but now I will come back to the region. I will have this case to discuss with about Somaliland and Somalia, what currently FAO is doing and what FAO has been doing since the last few years. So, FAO contribution to One Health. Number one, I'll be discussing about what FAO is doing in veterinary service delivery and zoonotic diseases. The second part, I'll also discuss what FAO is doing about food safety in terms of milk and meat, and also what FAO is doing about animal feed and early warning. It's very important to discuss about early warning, as we have all agreed climate change is also a very critical point that contributes, that we also have to discuss a lot about in this forum. I'll start with veterinary service delivery. So, the first one, what FAO is doing through the implementation, I will take this as the case of Somaliland, through the Ministry of Livestock and Fishery Development, FAO has FAO implement projects and activities that support control of transboundary animal diseases. I'll give you an example in 2019 and 2020 and 2021. For example, in 2020, in the case of Somaliland, FAO managed to support the vaccination of 3 million heads of animals through the Ministry of Livestock. We have reached about 75,000 households in 2020. We have treated 1.5 million animals with mandatory treatments, which are against the internal and external parasites. And also, these are very crucial activity because it protects and increases the value of livelihood assets of the communities that we are in Somaliland. And also it reduces the likelihood of disease spread or having a disease spread. In that case, what we were targeting was against a disease called contagious caprine pneumonia. It normally affects the goats and it's highly contagious disease. And since Somaliland is an exporting country, without having an active measures to control the communicable disease or transboundary animal disease, we will not be able to do this. We will not be able to export animals. And for the mandatory treatments, we control the diseases that may not be a transboundary animal disease, but they have consequence in terms of production, and they may also have a consequence in terms of public health importance. For example, when you treat parasites, these parasites will be going to our slaughterhouse. The animal will be slaughtered, and they will go to our mouth. So when you treat, you actually reduce you reduce the likelihood of public health hazard from animals to humans. That's an example of 2020, and if I expand that to Somalia, we have done further 12 million animals were also vaccinated in the same year. In that particular exercise, we also support the disease surveillance system in Somaliland, and through that exercise, we normally train the government staff to be so that we enable them to carry out disease surveillance, so that they can know the health status of the heads of animals that we have in Somaliland. We also do the similar exercise in Somalia. That case of 2020 also was repeated in 2021. The same number of animals were vaccinated, the same number of animals were treated, 3 million animals were vaccinated, 1.5 million heads of sheep and goat were given access to veterinary services, and also 75,000 households were reached. So, in this particular exercise, for example, in the case of Somaliland, 35 teams, which composed of 5 members each, it's almost 200 professionals, veterinary professionals, were engaged to do this activity. And apart from delivering the health services, they also do, apart from treating animals or vaccinating, they actually give sessions to the community, awareness, and also they give, for example, antimicrobial resistance. It's very, very, very important. So giving talk to the households, explaining that this drug is really important, but if you use in the wrong way, if you do not use it rationally, it can actually bring more problems than it gives more. The advantage will outweigh, the disadvantage will outweigh in future the advantage that we have for the veterinary antibiotics that we are using. So the teams that we are FAO through the Ministry of Livestock sending to the field, they actually also create that mass awareness on variety of areas, including antimicrobial resistance. This is the capacity building. We contribute in terms of training through community animal health workers training, the professionals training, the vets training in terms of disease reporting. We also have agropastoral farmer field schools, which we normally equip several knowledge skills that which can support the communities. Under the veterinary service delivery, FAO also do support the government to cold chain facilities, so that what we are dealing with is actually a vaccine, and having this cold chain facility enables vaccine to be delivered while they are still active. Without having a cold chain facility in the field and at the central level, you cannot be able to deliver vaccines which are effective. I'll now move to meat industry and what we are doing under the meat value chain. Meat safety and quality. This project, FAO has done a project in meat. This project is no longer active. We've concluded, but I'm going to show what was the achievement under this project. For example, under the meat safety, under the meat project, what we have done is we have supported the capacity of the professionals and the capacity of the butchers in terms of meat handling and meat safety, and also how they can take care of themselves while they are doing handling meat. So, as you can see, the first picture is that picture was taken from Bur'o. That's the Bur'o slaughterhouse. And the second picture you see here is the capacity building for meat inspectors. The government staff was trained, and in this particular activity, the University of Nairobi and Sheikh Technical Veterinary School were engaged to support. Also, in this project, we have achieved to support the Somaliland government to produce Meat Inspection and Control Act. It's a very important document. When we are discussing One Health in Somaliland, this will be one of the main documents that's going to support us. And it promotes the public health and safety through regulations and control. It will discuss about how you are going to slaughter, what are the meat distributions in terms of how are you going to distribute meat, and all the procedures and that to be followed while meat is handled from the farm to the fork. So this is really an important document that you might need when you are going to talk about the meat safety in Somaliland. And also the infrastructure. As you can see, the Bur'o slaughterhouse used to be a slab. It was not a slaughter. We used to have a slaughter slab, just an open place. But now this is what we have. It was improved infrastructure. And you know, infrastructure improvement plays an important role when it comes to safety of meat. Now I'll move to milk safety, and I'll be quick. I can see my time is almost up. So milk safety, what we have, I've also done a project in terms of milk safety. That project supports dairy cooperatives. In this project, you know, currently what we have, and still we have it, people use unsanitary milk containers, which are very difficult even to clean it. So in this project, what FAO did is they have distributed a lot of milk containers which are suitable, and then also we have trained we have trained a lot of the communities that we were targeting to improve in terms of milk, how they can improve milk. And this value chain is quite long. It starts from the farm. It starts from the animal health, and it starts from the other. You have to look at mastitis. You have to look what can happen. You know, you have to think about the animals. You have to think the materials. You have to think about the people who are handling it. You have to think the transportation. You have to think from the market in. So it was a long project, and it was also tackling along the value chain of the milk value chain. And this infrastructure was the Gobonimo Milk Market, and FAO also contributed to that. And then also FAO contributed to the revision of National Dairy Act. National Dairy Act is also a very important document that you will need when we are discussing further in how we are going to take up the One Health initiative in Somaliland. And it will talk about, in that it applies all, raw milk, processed milk, milk powder, everything. The National Dairy Act, we already have it. It already passed, the Parliament already passed this act. And then this is that it has standards that are affecting the feedstuffs, the use of veterinary animals, the production, how the milk are produced, and so on, and how milk are transported, how milk are stored at one temperature. Everything, it's also, you will also find it. FAO has, apart from livestock, it has a very important component. It's called SWALIM. SWALIM is the Water and Land Information Management Project. It's an information management unit, and it's actually, since we have a lot of change in terms of climate change, it is the hub that provides information regarding to the change of weather. It gives you early warning messages which can actually help you to make decisions in terms of, like for example, say in Somalia, they have, SWALIM has already measures the floods. So before the floods come, they can give you a real-time information when the floods will be likely to happen and so on. So the cyclone and everything, we also have this. Lastly, we have also livestock feed projects. And the livestock feed project, one of the key important things is feed safety. Nowadays, you know, we don't only look the safety in terms of what people are eating, but also what animals are eating is very important. For example, if we do not take care of what animals are eating, they could be eating a lot of feed stuff that has aflatoxins. And even if you, and aflatoxins, when the animals eat, it could be transmitted through milk. So when you drink that milk, even if you boil it, aflatoxins are heat resistant. So it's very difficult, and you will have it, and I'm sure you know what aflatoxins could bring to the, it can even cause cancer to humans. So we work on this area. And lastly, the project that we have done, so lastly, we have done one project which is actually integrated animal and human vaccinations with the UNICEF and WHO. We have done one project, and this is what we were achieving. So we were trying to integrate the animal health and also the human health. We were also integrating the promotion of wash and breastfeeding. Thank you.
Okay, thank you very much. Abdider from FAO. I'm sorry to interrupt you, but it's also important to keep the time. I would like, if there is anyone who would ask one or two questions to Dr. Abdelghani, Abdider, Dr. Mohammed Qayad, please welcome.
I can hear you very well.
Yeah, it's not a question. Asking the question is, there is a lot of information which at the FAO, and I was searching all of those informations, and I couldn't find all those information. My question is, how often do you share with the Ministry of Health this information? This is what I was talking, the territorial intransigence of information sharing. And this is actually hampered the Ministry of Health when it comes to the planning, or even if they develop one health by itself. So how often do you share? Thank you.
Okay. First of all, this information do not only belong to FAO. The Ministry of Livestock and Fishery Development of Somaliland has it, and it's the main implementer in all the activities that FAO is doing. So I think government coordination mechanisms are needed to the government to share what they have. But with this right forum, I can say it is the right opportunity that all sectors work together. And one of the biggest advantage we have all the puzzle, we have all what we need to implement One Health. We have a Ministry of Animal Health, a Ministry of Livestock and Fishery Development, who is very strong, has a lot of capacities, also implementing a lot, and actually they have a lot of young professionals. They have the skills, they have everything, and also we have the Ministry of Health and other ministries who also have the same. So we also have the international community, the UN agency, who are supporting the Ministry of Livestock. For example, FAO supports, the Ministry of Health, the WHO supports, UNICEF supports. So it's just a matter of time before we came together and join all those information we have, and we approach everything that we are doing in one. I wanted to show you the last slide, and that's where I really wanted to emphasize that because of the time I could not it. WHO, UNICEF, and FAO, they came together. They said, you know what? You are doing animal health, and we are doing human health, and we are doing WASH. So why can't we do it together? And that's what we did. And I was actually showing you this. There is actually that FAO, together with OIE and WHO, implemented. Yeah? So they created, and it's actually available online. Is there a current project in, as far as I know, in Somaliland and Somalia, which we are using One Health approach? No, but it's a matter of time before we start. I think it is the right forum that will initiate such initiative, because it's very, very important area to look at.
Yeah, I think that's a good point, Abdul Ghani. Klaus, for Abdul Ghani, one more question. First, the lady.
First of all, thank you, Abdidak, for the nice presentation. We all know that FAO has done so well in certain sectors like building, slaughterhouse, milk markets, and so on. So my question is, what have you done so far to tackle the problem of antimicrobial resistance?
Okay. Yeah. What we have done so far in terms of antimicrobial resistance. Antimicrobial resistance is, as I already said, is a very, very, very important topic. And it's something that can kill us. If we do not take actions now, the diseases that we can easily treat now will kill us in the future. Simple as that. So what we did, whenever we are doing a program, we integrate it. First of all, we adopted a policy that we reduce the antimicrobial use in our projects. Number one. Two, through the training that we provide community animal health workers, one of the main reasons that the community animal health workers are trained are to reduce the irrational use of veterinary drugs. Because if you have every village one animal health worker, he is equipped to have a knowledge to use drugs rationally. Otherwise, what you can have is that a community, someone who can buy drugs, you know, drugs are accessible everywhere. They can buy drugs and they can use any dose they want, they can use any route they want, and most importantly, they do not observe the withdrawal period, which is very, very critical. So through the programs we have, we do that community mobilization. Like, for example, when we are targeting 75,000 households in Somaliland only, the message we transmit also includes the AMR. So communities are heavily mobilized. But it's a topic which even need more resources and more inputs.
Thank you very much, Dr. Abdidak. I think it was excellent explanation of what FAO is doing in this area. I'm a bit critical on there, and I think FAO, since it's already working with the international community, with FAO and with WHO and other agencies, for example in Somaliland, on this one health approach, they should have been also working with the Minister of Health and also with the universities. But I hope they will do that. They will start now after this conference. Now we will move to the the other session, which is the group discussion on creating one health network and sustainability. And we have chosen a moderator for that topic. I will invite Farah Isse from Liverpool. Please welcome here, so you can moderate that session or that discussion. As I understand, we will divide into groups, and we will discuss about a certain number of questions, and then there will be presentations by each group. Please, Issa.
Thank you very much, Mr. Chairman. We will be moving to our next stage of the discussions, and we believe it will be an interesting session. And one of the main objectives of this networking conference was to create a network of organizations, particularly universities, that can collaborate in this sector in the future. So the main purpose was to create a network. So before we go to the declaration that we were talking about yesterday and the agreement, we need to have a little reflective session or a little discussion where we will be discussing how the network we need will look like. So in this session, we will be dividing the universities that are invited to this conference into 3 groups. I will be mentioning each group, then Naima and her team will arrange the seats for each group. So here we go. We have group 1. In group 1, we have Addis Ababa University. We have Burao University. We have Edna Aden University. We have Amud University, Simmat University. This 1, 2, 3, 4, 5 universities will be in group 1. So Naima and her team will be arranging the seats for this group. And then, can I repeat group 1? Group 1 means Addis Ababa University, Burao University, Edna Aden University, Simmat University, and Amud University. In group 2, we have East Africa University, Golis University, Mogadishu University, University of Nairobi, University of Hargeisa. These are in group 2. Let me repeat. In group 2, Golis University, East Africa University, Mogadishu University, University of Nairobi, and University of Hargeisa. They are group 2. In group 3, we have Benadir University, Djibouti University, Haramaya University, Jigjiga University, Red Sea University, Sheikh Technical Veterinary School, and Abrar University. Then when we have our cities of each group, then we will be explaining what are the main points that we will be discussing during this short term. But first I will give the follow to Nim'a and her team so they can arrange the seats for each group.
Okay, thank you, Dr. Farah. I would request
University will be in group 1. Sorry for that mistake.
umaga fogbaadadhaga aqoontuna waa halbeeg markay hamileedaho amud qof dhigta ahantee amudey hoodad badan bulshada waad haqabtirte hajiro magaca hajiro ilal saamilowda umaga fogbaadadhaga aqoontuna waa halbeeg markay hamileedaho amud qof dhigta ahantee amudey hoodad badan bulshada waad haqabtirte hajiro magaca hajiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahayaqtaan barwaaqiyo haybadlo amudey hoodad badan bulshada waad haqabtirte ajira magaca jiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahayaqtaan barwaaqiyo haybadlo amudey hoodad badan bulshada waad haqabtirte ajira magaca jiro usiyo habrasha kullida rajiyo hamiba libdala awliyo ficilba hirgala amudey hoolad badan gaadiidkii horumarkiyo ilinka nabad loo maray amudey hoolad badan gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo
magacaygu waxa weeyaan Nimco Naasir waxaan ka socdaa jaamacadda Amuud kulliyadda medicine-ka waxaan idinku soo dhaweynayaa shirka One Health Conference for Horn of Africa University kaasoo socon doona insha Allah January ilaa 3 ilaa 5 diiwaanka xanuunada dad yahay sii biiraya tikhawga dhulkeena iyo duur joogta qayb ka ah dad yahay ma ogsoontihiin ma jiro deer kala dhaxyaan duriga shimbiraha ku dhici dadkana uu maaga yahay dawada beeraha u roon dadkii bay leeynaysaa aad baad u mahadsantihiin shirkaasaan idinku soo dhaweynaynaa insha Allah waxa one word and one health.
My name is Ahmed Deq, a final year medical student. The One Health Approach program is a program that supports the global health security by improving the communication, coordination, as well as the collaboration of the 3 major health departments. These are the animal, the human, and environment, and addresses their shared health threats. They indeed have a shared health threats. So bad environment negatively influences the animal health, which in turn disrupts human health. So again, it's my pleasure to welcome you to the One Health Conference, hosted by Amoudi University on 3rd of July, held in Boroma City.
My name is Abdhakim Yassin, a 5th year medical student. The movement of people and animal products has now significantly increased due to international travel and trade. And as a result, diseases can spread quickly across the borders and around the globe. And it is now estimated that 60% of all emerging infectious diseases in humans are due to zoonotic pathogens. Therefore, it's a very thin line between animal health and human health. And finally, I'm very delighted to welcome you to One Health Conference, which is going to be held in Boroma on January the 3rd.
magacaygu waa Maxamed Ismaaciil Cabdullaahi ka tirsan kulliyadda beeraha iyo deegaanka jaamacadda Amuud waxaan ku faraxsanahay inaan kugu soo dhaweeyo shirka ka dhacaya magaalada Boroma gaar ahaan jaamacadda Amuud oo ah One Health Network, Horn of African Universities. Soo dhawow, welcome.
magacay waa Farxaan Jaamac oo cilmi oo dhigta jaamacadda Camuud kulliyadda beeraha iyo deegaanka iyo xanaanada xoolaha waxaan ku faraxsanahay inaan ku soo dhaweeyo One Health Network Horn of Africa shirkaas oo ka dhacaya magaalada Boorama gaar ahaan jaamacadda Camuud aad baan idin soo dhaweynayaa
Ilhaan Maxamed Dhaayo ka tirsan ardayda jaamacadda Camuud ka soo jeeda gobolka Hiiraan waxaan idinku soo dhaweynayaa One Health Conference for Horn of Africa University oo ka dhici doona magaalada Boorama gaar ahaan jaamacadda Camuud waxaan leeyahay welcome.
My name is Abdiqani Muse. I'm the chairperson of Camuud Student Union. I'm very happy to welcome you all for One Health Conference for Horn of Africa Universities that will be hosted in Camuud University, Boorama for the 3rd, 4th and 5th of January 2022. Welcome all to Camuud University.
magacaygu waxa weeyaan Nimco Naasir waxaan ka socdaa jaamacadda Camuud kulliyadda Medicine-ka waxaan idinku soo dhaweynayaa shirka One Health Conference for Horn of Africa University kaasoo socon doona insha Allah January ilaa 3 ilaa 5 diiwaanka xanuunada dad yahay sii biiraya tikhawga dhulkeena iyo duur joogta qayb ka ah dad yahay ma ogsoontihiin ma jiro deer kala dhaxyaan duriga shimbiraha ku dhici dadkana uu maagan yahay dawada beeraha u roon dadkii bay leeynaysaa aad baad u mahadsantihiin shirkaasaan idinku soo dhaweynaynaa insha Allah waxa one word and one health.
My name is Ahmed Deq, a final medical student. The One Health Approach program is a program that supports the global health security by improving the communication, coordination, as well as the collaboration of the 3 major health departments. These are the animal, the human, and environments, and addresses their shared health threats. They indeed have a shared health threats. So bad environment negatively influences the animal health, which in turn disrupts human health. So again, it's my pleasure to welcome you to the One Health Conference, hosted by Camuud University on 3rd of July, held in Boorama City.
My name is Abdihakim Yassin, a 5th-year medical student. The movement of people and animal products has now significantly increased due to international travel and trade. And as a result, diseases can spread quickly across the borders and around the globe. And it is now estimated that 60% of all emerging infectious diseases in humans are due to zoonotic pathogens. Therefore, it's a very thin line between animal health and human health. And finally, I'm very delighted to welcome you to One Health Conference, which is going to be held in Boorama on January the 3rd.
magacaygu waa Maxamed Ismaaciil Cabdillaahi ka tirsan kulliyadda beeraha iyo deegaanka jaamacadda Camuud waxaan ku faraxsanahay inaan kugu soo dhaweeyo shirka ka dhacaya magaalada Boorama gaar ahaan jaamacadda Camuud oo ah One Health Network Horn of African Universities soo dhawow welcome
magacay waa Farxaan Jaamac oo cilmi oo dhigta jaamacadda Camuud kulliyadda beeraha iyo deegaanka iyo xanaanada xoolaha waxaan ku faraxsanahay inaan ku soo dhaweeyo One Health Network Horn of Africa shirkaas oo ka dhacaya magaalada Boorama gaar ahaan jaamacadda Camuud aad baan idin soo dhaweynayaa
Ilhaan Maxamed Dhaayo ka tirsan ardayda jaamacadda Camuud ka soo jeeda gobolka Hiiraan waxaan idinku soo dhaweynayaa One Health Conference for Horn of Africa University oo ka dhici doona magaalada Boorama gaar ahaan jaamacadda Camuud waxaan leeyahay welcome.
My name is Abdiqani Muse. I'm the chairperson of Camuud Student Union. I'm very happy to welcome you all for One Health Conference for Horn of Africa Universities that will be hosted in Camuud University, Boorama for the 3rd, 4th and 5th of January 2022. Welcome all to Camuud University.
magacaygu waxa weeyaan Nimco Naasir waxaan ka socdaa jaamacadda Camuud kuliyadda Medicine-ka waxaan idinku soo dhaweynayaa shirka One Health Conference for Horn of Africa University kaasoo socon doona insha Allah January ilaa 3 ilaa 5 diiwaanka xanuunada dad yahay sii biiraya tikhawga dhulkeena iyo duur joogta qayb ka ah dad yahay moogsoontihiin ma jiro deer kala dhex yaal duriga shimbiraha ku dhici dadkana uu maagan yahay dawada beeraha u roon dadkii bay leeynaysaa aad bay u mahadsantihiin shirkaasaan idinku soo dhaweynaynaa insha Allah waxa one word and one health.
My name is Ahmed Deq, a final year medical student. The One Health Approach program is a program that supports the global health security by improving the communication, coordination, as well as the collaboration of the three major health departments. These are the animal, the human, and environment, and addresses their shared health threats. They indeed have a shared health threats. So bad environment negatively influences the animal health, which in turn disrupts human health. So again, it's my pleasure to welcome you to the One Health Conference, hosted by Amoudi University on 3rd of July, held in Boroma City.
My name is Abdulhakim Yassin, a 5th-year medical student. The movement of people and animal products has now significantly increased due to international travel and trade. And as a result, diseases can spread quickly across the borders and around the globe. And it is now estimated that 60% of all emerging infectious diseases in humans are due to zoonotic pathogens. Therefore, it's a very thin line between animal health and human health. And finally, I'm very delighted to welcome you to One Healthy Conference, which is going to be held in Boroma on January the 3rd.
magacaygu waa Maxamed Ismaaciil Cabdillaahi ka tirsan kuliyadda beeraha iyo deegaanka jaamacadda Camuud waxaan ku faraxsanahay inaan kugu soo dhaweeyo shirka ka dhacaya magaalada Boorama gaar ahaan jaamacadda Camuud oo ah One Health Network Horn of Africa Universities soo dhawow welcome
magacaygu waa Farxaan Jaamac oo cilmi oo dhigta jaamacadda Camuud kuliyadda beeraha iyo deegaanka iyo xanaanada xoolaha waxaan ku faraxsanahay inaan ku soo dhaweeyo One Health Network Horn of Africa shirkaas oo ka dhacaya magaalada Boorama gaar ahaan jaamacadda Camuud aad baan idin soo dhaweynayaa
Ilhaan Maxamed Daayo ka tirsan ardayda jaamacadda Camuud ka soo jeeda gobolka Hiiraan waxaan idinku soo dhaweynayaa One Health Conference for Horn of Africa University oo ka dhici doona magaalada Boorama gaar ahaan jaamacadda Camuud waxaan leeyahay welcome.
My name is Abdulghani Muse. I'm the chairperson of Amoudi Student Union. I'm very happy to welcome you all for One Health Conference for Horn of Africa Universities that will be hosted in Amoudi University, Boroma for the 3rd, 4th, and 5th of January 2022. Welcome all to Amoudi University.
magacaygu waxa weeyaan Nimco Naasir waxaan ka socdaa jaamacadda Camuud kuliyadda Medicine-ka waxaan idinku soo dhaweynayaa shirka One Health Conference for Horn of Africa University kaasoo socon doona insha Allah January ilaa 3 ilaa 5 diiwaanka xanuunada dad yahay sii biiraya tikhawga dhulkeena iyo duur joogta qayb ka ah dad yahay moogsoontihiin ma jiro deer kala dhex yaal duriga shimbiraha ku dhici dadkana uu maagan yahay dawada beeraha u roon dadkii bay leeynaysaa aad bay u mahadsantihiin shirkaasaan idinku soo dhaweynaynaa insha Allah waxa one word and one health.
My name is Ahmed Deq, a final year medical student. The One Health Approach program is a program that supports the global health security by improving the communication, coordination, as well as the collaboration of the three major health departments. These are the animal, the human, and environment, and addresses their shared health threats. They indeed have a shared health threats. So bad environment negatively influences the animal health, which in turn disrupts human health. So again, it's my pleasure to welcome you to the One Health Conference, hosted by Amoudi University on 3rd of July, held in Boroma City.
My name is Abdulhakim Yassin, a 5th-year medical student. The movement of people and animal products has now significantly increased due to international travel and trade. And as a result, diseases can spread quickly across the borders and around the globe. And it is now estimated that 60% of all emerging infectious diseases in humans are due to zoonotic pathogens. Therefore, it's a very thin line between animal health and human health. And finally, I'm very delighted to welcome you to One Healthy Conference, which is going to be held in Boroma on January the 3rd.
magacaygu waa maxamed ismaaciil cabdilaahi ka tirsan kulliyadda beeraha iyo deegaanka jaamacadda camuud waxaan ku faraxsanahay inaan kugu soo dhaweeyo shirka ka dhacaya magaalada boorama gaar ahaan jaamacadda camuud oo ah One Health Network Horn of African Universities soo dhawow welcome
magacaygu waa farxaan jaamac cilmi oo dhigta jaamacadda camuud kulliyadda beeraha iyo deegaanka iyo xanaanada xoolaha waxaan ku faraxsanahay inaan ku soo dhaweeyo One Health Network Horn of Africa shirkaas oo ka dhacaya magaalada boorama gaar ahaan jaamacadda camuud aad baan idin soo dhaweynaya
Ilhaan Maxamed Daayo ka tirsan ardayda jaamacadda camuud ka soo jeeda gobolka Hiiraan waxaan idin ku soo dhaweynayaa One Health Conference for Horn of Africa University oo ka dhici doona magaalada boorama gaar ahaan jaamacadda camuud waxaan leeyahay welcome
My name is Abdiqani Muse. I'm the chairperson of Amud Student Union. I'm very happy to welcome you all for One Health Conference for Horn of Africa Universities that will be hosted in Amud University, Porama for the 3rd, 4th and 5th of January 2022. Welcome all to Amud University.
magacaygu waxa weeyaan Nimco Naasir waxaan ka socdaa jaamacadda Camuud kulliyadda Medicine-ka waxaan idinku soo dhaweynayaa shirka One Health Conference for Horn of Africa University kaas oo socon doona insha Allah January ilaa 3 ilaa 5 diiwaanka xanuunada dad yahay sii biiraya tiqawga dhulkeena iyo duur joogta qayb ka ah dad yahay ma ogsoontihiin ma jiro deer kala dhaxyaal duriga shimbiraha ku dhici dadkana uu maagan yahay dawada beeraha u roon dadkii bay leeynaysaa aad baad u mahadsantihiin shirkaasaan idinku soo dhaweynaynaa insha Allah waxa one word and one health.
My name is Ahmed Deq, a final year medical student. The One Health Approach program is a program that supports the global health security by improving the communication, coordination, as well as the collaboration of the 3 major health departments. These are the animal, the human, and environment, and addresses their shared health threats. They indeed have a shared health threat. So bad environment negatively influences the animal health, which in turn disrupts human health. So again, it's my pleasure to welcome you to the One Health Conference, hosted by Amud University on 3rd of July, held in Boroma City.
My name is Abdhakim Yassin, a 5th year medical student. The movement of people and animal products has now significantly increased due to international travel and trade. And as a result, diseases can spread quickly across the borders and around the globe. And it is now estimated that 60% of all emerging infectious diseases in humans are due to zoonotic pathogens. Therefore, it's a very thin line between animal health and human health. And finally, I'm very delighted to welcome you to One Health Conference, which is going to be held in Boroma on January the 3rd.
magacaygu waa maxamed ismaaciil cabdilaahi ka tirsan kulliyadda beeraha iyo deegaanka jaamacadda camuud waxaan ku faraxsanahay inaan kugu soo dhaweeyo shirka ka dhacaya magaalada boorama gaar ahaan jaamacadda camuud oo ah One Health Network Horn of African Universities soo dhawow welcome
magacaygu waa farxaan jaamac cilmi oo dhigta jaamacadda camuud kulliyadda beeraha iyo deegaanka iyo xanaanada xoolaha waxaan ku faraxsanahay inaan ku soo dhaweeyo One Health Network Horn of Africa shirkaas oo ka dhacaya magaalada boorama gaar ahaan jaamacadda camuud aad baan idin soo dhaweynaya
Ilhaan Maxamed Daayo ka tirsan ardayda jaamacadda camuud ka soo jeeda gobolka Hiiraan waxaan idinku soo dhaweynayaa One Health Conference for Horn of Africa University oo ka dhici doona magaalada boorama gaar ahaan jaamacadda camuud waxaan leeyahay welcome
My name is Abdiqani Muse. I'm the chairperson of Amud Student Union. I'm very happy to welcome you all for One Health Conference for Horn of Africa Universities that will be hosted in Amud University, Porama for the 3rd, 4th and 5th of January 2022. Welcome all to Amud University.
magacaygu waxa weeyaan Nimco Naasir waxaan ka socdaa jaamacadda Camuud kulliyadda Medicine-ka waxaan idinku soo dhaweynayaa shirka One Health Conference for Horn of Africa University kaas oo socon doona insha Allah January ilaa 3 ilaa 5 diiwaanka xanuunada dad yahay sii biiraya tiqawga dhulkeena iyo duur joogta qayb ka ah dad yahay ma ogsoontihiin ma jiro deer kala dhaxyaal duriga shimbiraha ku dhici dadkana uu maagan yahay dawada beeraha u roon dadkii bay leynaysaa aad baad u mahadsantihiin shirkaasaan idinku soo dhaweynaynaa insha Allah waxa one word and one health.
My name is Ahmed Deq, a final year medical student. The One Health Approach program is a program that supports the global health security by improving the communication, coordination, as well as the collaboration of the three major health departments. These are the animal, the human, and environment, and addresses their shared health threats. They indeed have a shared health threats. So bad environment negatively influences the animal health, which in turn disrupts human health. So again, it's my pleasure to welcome you the One Health Conference, hosted by Amoud University on 3rd of July, held in Boroma City.
My name is Abdhakim Yassin, a 5th year medical student. The movement of people and animal products has now significantly increased due to international travel and trade. And as a result, diseases can spread quickly across the borders and around the globe. And it is now estimated that 60% of all emerging infectious diseases in humans are due to zoonotic pathogens. Therefore, it's a very thin line between animal health and human health. And finally, I'm very delighted to welcome you to One Health Conference, which is going to be held in Boroma on January the 3rd.
magacaygu waa maxamed ismaaciil cabdilaahi ka tirsan kulliyadda beeraha iyo deegaanka jaamacadda camuud waxaan ku faraxsanahay inaan kugu soo dhaweeyo shirka ka dhacaya magaalada Boorama gaar ahaan jaamacadda camuud oo ah One Health Network Horn of African Universities soo dhawow welcome
magacaygu waa Farxaan Jaamac Cilmi oo dhigta jaamacadda camuud kulliyadda beeraha iyo deegaanka iyo xanaanada xoolaha waxaan ku faraxsanahay inaan ku soo dhaweeyo One Health Network Horn of Africa shirkaas oo ka dhacaya magaalada Boorama gaar ahaan jaamacadda camuud aad baan idin soo dhaweynayaa
Ilhaan Maxamed Daayo ka tirsan ardayda jaamacadda camuud ka soo jeeda gobolka Hiiraan waxaan idinku soo dhaweynayaa One Health Conference for Horn of Africa University oo ka dhici doona magaalada Boorama gaar ahaan jaamacadda camuud waxaan leeyahay welcome.
My name is Abdulghani Musa. I'm the chairperson of Amoud Student Union. I'm very happy to welcome you all for One Health Conference for Horn of Africa Universities that will be hosted in Amoud University, Boroma for the 3rd, 4th, and 5th of January 2022. Welcome all to Amoud University.
magacaygu waxa weeyaan Nimco Naasir waxaan ka socdaa jaamacadda Camuud kulliyadda medicine-ka waxaan idinku soo dhaweynayaa shirka One Health Conference for Horn of Africa University kaasoo socon doona insha Allah January ilaa 3 ilaa 5 diiwaanka xanuunada dad yahay sii biiraya tiqowga dhulkeena iyo duur joogta qayb ka ah dad yahay moogsoontiye ma jiro deer kala dhaxyaan
habrasha kullida rajiyo hamiba libdala awliyo fi'il bahir gala amude hola balan yaridki horumarkiyo ilinka nabadlo maray amude hola balan yaridki horumarkiyo ilinka nabadlo maray libtiyo hawladun dadal halneba horka qusiyo habrasha kullida rajiyo hamiba libdala awliyo fi'il bahir gala amude hola balan yaridki horumarkiyo ilinka nabadlo maray ilan samilawda umaga fogba hadalhaga aqontuna waa halbeeg markay hamileedaho amud qof dhigta hantee badan bulshada waada haqabtirte ajiro magaca hajiro wiilal saamilowdana umaga fog baadalhaga aqoontuna waa halbeeg markay hami leedaho camur qof dhigta ahantee camuudey hooda badan bulshada waada xaqabtirte ha jiro magaca ha jiro calanka hawaada lusho iibiyo sharaf baatida waxaad huwa tahay yaqaan barwaaqiyo haybadlo camuudey hooda badan bulshada waad xaqabtirte ha jiro magaca jiro calanka hawaada lusho iibiyo sharaf baatida waxaad huwa tahay yaqaan barwaaqiyo haybadlo camuudey hooda badan bulshada waad xaqabtirte ha jiro magaca jiro gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halnebaa horkaca quusiyo habrasha kullida rajiyo hamiba libdhala awliyo ficilba hirgala gaadiidkii horumarkiyo ilinka nabad loo maray camuudey hooda badan gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halnebaa horkaca quusiyo habrasha kullida rajiyo hamiba libdhala awliyo ficilba hirgala camuudey hooda badan gaadiidkii horumarkiyo ilinka nabad loo maray wiilal saamilowdana umaga fog baadalhaga aqoontuna waa halbeeg markay hami leedaho camur qof dhigta ahantee camuudey hooda badan bulshada waada xaqabtirte ha jiro magaca ha jiro wiilal saamilowdana umaga fog baadalhaga aqoontuna waa halbeeg markay hami leedaho camur qof dhigta ahantee camuudey hooda badan bulshada waad xaqabtirte ha jiro magaca ha jiro calanka hawaada lusho iibiyo sharaf baatida waxaad huwa tahay yaqaan barwaaqiyo haybadlo camuudey hooda badan bulshada waad xaqabtirte ha jiro magaca jiro calanka hawaada lusho iibiyo sharaf baatida waxaad huwa tahay yaqaan barwaaqiyo haybadlo haqabtirte ajir magacaa jiro gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halneba horkaca quusiyo habrasha kullida rajiyo hamiba libdhala awliyo ficilba hirgala gaadiidkii horumarkiyo ilinka nabad loo maray amuudee hoodad badan gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halneba horkaca quusiyo habrasha kullida rajiyo hamiba libdhala awliyo ficilba hirgala amuudey hoola badan gaadiidkii horumarkiyo ilinka nabad loo maray ilal saamilowdana umaga fogbaadadhaga aqoontuna waa halbeeg markay hami leedaho camud qof dhigta ahantee camudey hoodad badan bulshada waada haqabtirte ajiro magaca hajiro ilal saamilowdana umaga fogbaadadhaga aqoontuna waa halbeeg markay hami leedaho camud qof dhigta ahantee camudey hoodad badan bulshada waada haqabtirte ajiro magaca hajiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahay yastaan barwaaqiyo haybadlo camudey hooda badan bulshada waad haqabtirte ajir magaca jiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahay yastaan barwaaqiyo haybadlo camudey hooda badan bulshada waad haqabtirte ajir magaca jiro gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halneba horkaca quusiyo habrasha kullida rajiyo hamiba libdhala awliyo ficilba hirgala amuudey hoola badan gaadiidkii horumarkiyo ilinka nabad loo maray amuudey hooda badan gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halneba qusiyo habrasha kullida rajiyo hamiba libdala qawliyo ficilba hirgala amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray إلى الصامر لودا وما فوق بهذا الحياة أقنت لوها البيك مركها من ليزاهو عمو القف ديكتها هانته عمو دي هودا بدن والشدواد حقبتلته أجيرو مقاحا أجيرو إلى السامي اللوضة وما قفوق بهذا الحياة أقنت لوها البيك مركها من ليزاهو عمو القف ديكتها هانته عمو دي هودا بدن والشدواد حقبتلته أجيرو مقاحا أجيرو علنك هوادا لشو يبي شرف باتدا وحد هو التهيئتان رواقي وهيب الله عمودي هودا بدن والشدواد وحقبتلته أجر مقاعا أجرو علنك هوادا لشو يبي شرف باتدا وحد هو التهيئتان رواقي وهيب الله عمودي هودا بدن والشدواد حقبتلته أجر مقاعا أجرو gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halneba horkaca qusiyo habrasha kullida rajiyo hamiba libdala qawliyo ficilba hirgala amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halneba horkaca qusiyo habrasha kullida rajiyo hamiba libdala qawliyo ficilba hirgala amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray إلى السامي اللوضة وما قفوق بهذا الحياة أقنت لوها البيك مركها من ليزاهو عمو القف ديكتها هانته عمو دي هودا بدن والشدواد حقبتلته أجيرو مقاحا أجيرو إلى السامي اللوضة وما قفوق بهذا الحياة أقنت لوها البيك مركها من ليزاهو عمو القف ديكتها هانته عمو دي هودا haqabtirte hajiro magaca hajiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahay yaqaan barwaaqiyo haybadlo badan bulshada waad waxa qabtirte ajira magaca jiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahay yaqaan barwaaqiyo haybadlo bulshada waad waxa qabtirte ajira magaca jiro hooda badan gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun daadal halneba horkaca quusiyo habrasha kullida rajiyo hamiba libdhala qawliyo ficilba hirgala camuudey hooda badan gaadiidkii horumarkiyo ilinka nabad loo maray hooda badan gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun daadal halneba horkaca quusiyo habrasha kullida rajiyo hamiba libdhala qawliyo ficilba hirgala gaadiidkii horumarkiyo ilinka nabad loo maray ilal saamilowdana umaga fogbaadadhaga aqoontuna waa halbeeg markay hamileedaho camur qof dhigta hantee bulshada waad waxa qabtirte hajiro magaca hajiro ilal saamilowdana umaga fogbaadadhaga aqoontuna waa halbeeg markay hamileedaho camur qof dhigta hantee bulshada waad waxa qabtirte hajiro magaca hajiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahay yaqaan barwaaqiyo haybadlo bulshada waad waxa qabtirte ajira magaca jiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahay yaqaan barwaaqiyo haybadlo bulshada waad waxa qabtirte ajira magaca jiro nabad loo maray libtiyo hawlaadun dadaal halneba horkaca quusiyo habrasha kullida rajiyo hamiba libdhala awliyo ficilba hirgala amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halneba horkaca quusiyo habrasha kullida rajiyo hamiba libdhala awliyo ficilba hirgala amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray ilal samilawdana umaga fogba dadhaga aqoontuna waa halbeeg markay hamileedaho camud qof dhigta ahantee amudey hoodad badan bulshada waada haqabtirte hajiro magaca hajiro ilal samilawdana umaga fogba dadhaga aqoontuna waa halbeeg markay hamileedaho camud qof dhigta ahantee amudey hoodad badan bulshada waada haqabtirte hajiro magaca hajiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahayadaan barwa iyo haybadlo amudey hoodad badan bulshada waad haqabtirke ajira magaca jiro calanka hawada lusho iibiyo sharaf baatida waxaad huwa tahayadaan barwa iyo haybadlo amudey hoodad badan bulshada waad haqabtirte ajira magaca jiro gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halneba horkaca quusiyo habrasha kullida rajiyo hamiba libdhala awliyo ficilba hirgala amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray libtiyo hawlaadun dadaal halneba horkaca quusiyo habrasha kullida rajiyo hamiba libdhala awliyo ficilba hirgala amudey hola badan gaadiidkii horumarkiyo ilinka nabad loo maray
Group 1's presentation. Please let us keep the silence and let us listen. Group 1, they have just 5 minutes to present and to be asked the questions. Please.
So thank you so much. So Group 1 is composed of 5 universities and 17 participants. Can I have the next slide, please? Next slide. The group is represented by 3 members from Addis Ababa University, 3 members from Edna Adan University, 1 from Simad, 11 from Amud, and 1 from Borana. The first question was whether it's useful to establish One Health network. So the consensus was yes. And the reason for this is essential for Horn of Africa share similar geography, climatic conditions, large animal population, and of course shared health problems. So because of this, we need to have this One Health network. The sectors to be involved, we have heated debate on this. Universities, all universities involved, for they are having easy work environment, similar characteristics, profiles, and so on and so forth, and the purpose functions, and consequently it is easier for the universities to be networked. However, we have said that university may also advocate for One Health at policy level to mobilize resources for One Health research, for One Health training, and for One Health community service. This is the responsibility of the university, and therefore we can basically advocate, play an important role advocating. Yet we recognize the involvement of all line ministries. We didn't list them all, but all line ministries could be involved. We didn't say should be members, because we don't have the authority as university to hold them accountable for that. NGOs that are involved in animal human health and climate can as well be involved in this process, and the international organizations such as FAO, UNICEF, WHO, and so on and so forth can as well be involved. Thematic areas of operation, of course, health, environment, climate change, agriculture, livestock, wildlife, water resources, community engagement, gender being mainstreamed on all those sectors, and diplomacy, conflict resolution are potentially important areas of operation. For sustaining this network in terms of finance and meeting, we said that the founding members should actually designate a secretariat to organize the establishment of a governance system within 1 year. So within 1 year, these founding members will designate a secretariat that will be responsible to finalize, disseminate, share with partners about the network itself. And within 1 year, the network will basically formalize a structure within a board and secretariat. And the financing should come from the universities that should basically take ownership of the network through membership fee. We suggested 500 USD per year for this per university, and of course seek grants and the partnership from regional institutions such as AU, IGAD, and so on and so forth, so that we can actually process that one. Thank you so much.
Yeah, this is well presented, and thank you very much for the presentation. I am really amazed the little time they had and how they have organized that discussion. It was interesting. So we don't have much time, but we can allow one question from each group, group 2 and group 3. If they have a question for group 1, we can just accommodate only 2 questions, one question from each group, the remaining groups. If there are no questions, we can proceed and invite group 2 to come here and present the summary of the discussion like group 1 did. Thank you.
قولي في عباه القلب
Okay, for group 1, the first part, we all of course agreed. We said yes, and the reasons for the establishment of the One Health network would be the need for facilitating joint research activities, also encourage collaboration between universities. It will also improve the information sharing and capacity building initiatives, and it will also improve the awareness about the One Health issues. For the second, what sectors to include the network would be the relevant academic institutions, research institutions, and relevant international and national organizations, relevant governmental institutions, and community organizations. The thematic areas of operation will focus on research and training and capacity building, as well as community engagement and advocacy, such as the policy making makers. For having sustainable, the sustainability approach of the network will include drafting and establishing MOU between the network members, and also establishment of management and coordination committee to oversee the activities, and for also resource mobilization that will include joint proposal development and the prioritization of One Health issues to have a sustainable funding for it. Also we'll have activities such as fundraising and human resource sharing, such as manpower and so on. Thank you. And if I left anything from my group, they can also add.
Or if other groups have any questions or group 2 presentation, we can accommodate just 1 or 2 questions. That means there are no questions. Okay. Thank you very much, group 2. Now we will move the last group and group 3. Dr. Amina Hussein will be representing in group 3. It seems that our ladies are dominating the presentations, which is very exciting. Please, Amina, welcome. You have 5 minutes for your presentation.
Establishment of One Health network for the universities. And the discussion outcome was, yes, we do agree establishment of One Health network. However, we feel that we should first of all think of if there is any existing networks in the region. If there are some, maybe we can join that networks. If there is no networks in the region, we can create a new network for the universities. The second question was, which sectors do you believe are to be invited? The network should only contain universities. However, in the workshops, in the conference, and in the events that we are disseminating some information, we can invite the non-academic organizations like the NGOs. The third question was, what do you think the thematic area of operation? Next slide, please. The thematic area will be research, capacity building, community engagement, and interdisciplinary collaboration. And how do you think that the network will be sustained? We think that the universities should allocate a small budget for the sustainability of the network. And in addition to that, we can have fundraising, and like we can do some proposal writing and something like that, something that we can have some funds from the funding organizations. The meeting, when it comes to the meeting, we feel that the meeting should be on yearly basis, and also it should be on rotation basis, whereby each university will invite other universities in each year. That was the conclusion of our discussion. Thank you.
Thank you very much, Amina. That was wonderful. This marks the end of this interactive session, and it seems that most of the areas that we need to collaborate in the future, that the universities will be able to at least coordinate this research, and if it's even training or other areas, all areas that we need to be discussed in the future are mentioned from the different presentations. And I would like to invite the chairman of the whole day, Dr. Yaqub, to proceed the rest of the day. Thank you very much.
I think we are now proceeding to the last part of the third part. I understand that all of us, or many of you, are hungry and they want to go and eat. The thing I would like to say is that now we will go for lunch. We will break for lunch, and after that, when we come back, we will make the presentations of the declaration, and after that, we make the closing ceremony. So please have your lunch and come back on time. Thank you very much.